Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program has a different healthcare professional every week on the program that talks about different issues relevant to you and your family members. I've got a really special guest on my show today, so I hope you'll stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Keiko Fakhraie. I don't know if I said that right. I'm going to call you Dr. Right. Keiko. Did I do it right that time? Good. Dr. Keiko works with Dr. Harris at Mountain Shadow Medical Center. I'm really glad you're on the show with me today. We've got a lot of things to learn about holistic medicine, I think you're going to share with us today. And that's, well, not a new field, obviously. That's been around for a long time, but maybe it's new as far as people knowing recently about holistic. There's been a lot of changes in holistic. So we'll talk about that today. Okay. But first of all, I want to get to know Keiko better. Can you tell me, how long have you been in Kingman?
Let's see. 4, 5 years.
Has it been that long already? Because I remember when you came, time flies. Huh? Very good. And you and your husband moved here from where?
From Iowa.
Oh, okay.
Well, actually, I was in a residency program in Missouri.
Okay.
Near Kansas City area. But suddenly, just the program closed, so I have to quickly find a next program. To continue, and so I found this Kingman Regional.
Oh, very good. So you came here as a resident.
Yes.
Okay.
And I ended up staying.
Right, because that's our residency program. That's with Midwestern University, right?
That's right.
So a lot of our, we've had quite a few doctors who've gone through that residency program and stayed because they fall in love with Kingman and with KRMC. It's a great place to work. And so your specialty, you went to school to be a doctor, and then is holistic medicine, is that like a subspecialty, or how does that work?
Okay. I went to medical school in Iowa, Des Moines University.
Okay.
And so I graduated. So at that time, I received a degree of DO, Doctor of Osteopathy, which is not MD.
Right.
And so in the United States, there are 2 different types of schools, allopathic schools, MD schools, and also DO schools. So I chose to become DO. And then after graduation, of course, everybody else, like going through the training period. And then I got a license of family medicine.
Family medicine.
So now the Dr. Harris is also board certified in holistic integrative holistic medicine, and so I learned about there is such board in the U.S. So well, during the residency program, I visited the conference, and then so as soon as I graduate and then get the first license, which is family medicine board certified, and then we could apply for, sit for the board.
Oh, okay. So it's a separate license.
So there must be someone, each individual physician has to have a primary license in something, and then
like family medicine,
or internal
medicine, something like
any
that.
field.
And then you get the holistic.
Integrative holistic.
Integrative.
Holistic medicine board exam, and then fortunately passed.
That's good. Those boards are tough from what I hear.
Well, that's why I got.
Very good. So holistic, I think my understanding, like the word almost says, it's whole. The whole body, and understanding how even everything is connected.
Whole being. Yes. The osteopathic, I'm a doctor of osteopathy, and the osteopathic principle is also whole person. So we have to deal with the whole person. And that's the reason why that I applied for only osteopathic schools. I never applied for allopathic schools. Because my interest and to me, I'm a Japanese origin. And so always I was educated and lived in a certain environment that everything is connected, everything is a whole, and you have to live in this environment. So work with the environment rather conquer it.
Right, right.
And
okay.
My background is a little maybe different, and so the osteopathic principle fit me much better, so that eventually when I start working, I can do what I want to do.
Right. Treat the whole person.
Right. And because you cannot cut this one and then done with it.
Yeah.
No way.
right. Yeah, absolutely. And I think from people I've talked to, patients of yours that just have so appreciated, number one, you listen and kind of try to understand exactly what's going on with them and their whole person, and the fact that you look at you don't just throw pills at them. You look at the other alternatives and things that might help them.
It depends upon what they wish.
Sure. Right.
Each individual. So I think being a physician is also an educator.
Right.
And
teaching
how
people.
and how important that each individual is aware of himself or herself. How perceives himself or herself, that influences the health.
How they feel.
Right.
Okay.
And then some people just do not want to take pharmaceutical medications.
Right.
They are very clear about that. And some other people want quick
fixes,
type of band.
They want to maybe change their lifestyle. They want just a pill so they can go on with what they're doing.
So usually, whoever comes to me and when we discuss about the problems of each individual, I ask what kind of things that they want, they wishes. Yeah. So.
Because I think nowadays, more than ever, it's important that individuals take responsibility for their health and realize that their lifestyle majorly impacts their health. Right, the choices they make day to day, and not just smoking, but the foods we eat, the exercise we get.
Not even exercise.
No exercise.
No, not even exercise. How they sit, how they stand, how they walk influences all internal functions. So it goes down to the real basic when I see people, and of course if I have time. Right. And if that is an appropriate the topic that we need to discuss, and then just getting down to real basic like that. The posture issue.
So the posture affects how you, I suppose it makes sense, how your blood flows through you.
The breathing.
Your breathing.
Like for example, when you stand up, sit appropriately, upright position, and then try to breathe, or
you're hunched over, makes a big
and
difference.
then breathe. That makes a huge difference.
Sure.
So we do in the treatment rooms, exam rooms, and then actually we try.
You try what?
Yeah. Well, I ask each individual to experiment or experience.
See the difference.
What's the difference?
Okay, that makes sense. So
yeah, because I believe that if someone can do every single day, even 1 minute of something to correct something the lifestyle, and then that helps a lot compared to one visit to the physician's office.
Right, you only see them for
who knows?
A few minutes, and then they have the rest of their week or whatever that
we don't know what they're doing.
Right. So that makes sense, and so you give them little exercises to try.
Or posture or whatever appropriate.
Breathing. Right. Very good. So, do you find people receptive to that? Okay. Yeah, that's good.
Because, as I said, my job is teaching also. So, important thing is each individual who I see understands what I'm talking about.
Sure.
If they don't understand, it's no use.
Right, too. Because then they're not going to change.
Right. So that's why usually I take longer time for each encounter.
Oh, okay.
Longer than many other physicians.
Yeah. Spend more time with
I'm
the
so
patient.
glad that I'm allowed to do that.
Yes, that's good. That's
Eventually, well, we may have to shorten gradually. I don't know.
as you get busier, see more
right,
patients, right?
Yeah, to accommodate. That's something I don't know yet. Yet, I try to spend as much time as possible for listening and teaching and discussing the problems.
So now you and Dr. Harris just a couple months ago moved into your new offices on Wallapai Mountain Road, right across from the new Mojave State Bank. Mountain Shadow Medical Center, is that right? And Mountain Shadow Family Medicine is the name of your practice.
Our part.
Right, your side of it. So it's kind of two sides. You have Dr. Joe right now with internal medicine on one side, and then you and Dr. Harris and
Dr. Kingman,
is on your side. So it's a beautiful new building. We've been there when we did the ribbon cutting, and it's just gorgeous.
Yeah, it is big.
Yeah, big, and lots of room for growth, so that's good. As we add more doctors and you see more patients, you'll have more room to see them all.
Right.
So that's very good. And beautiful views of the mountains, obviously. A good name for the practice as well.
Yeah.
So when you give the patients these exercises and then they follow up at home, do you usually see pretty quick results if they do it consistently like they're supposed to?
Yeah,
Good.
if they do, I can see it.
Right. So explain to me, we talked about your breathing and the difference. Are there some other examples that you could share with us of how, when you're talking about our posture impacts, what else?
Right. In relation to posture, and I do osteopathic manipulations.
Oh, okay.
And it's not a chiropractic. Many people know chiropractics type of treatment, and also they know massages, but it's not quite. But osteopathic manipulations can go those ranges, either direction.
Oh, so from both a massage to a
chiropractic type
adjustment.
of, adjustment type of treatment. But what I do is a little different, and all those treatment we had to learn anyway during the medical school time.
I didn't realize that.
But after graduation, especially, I started to learn more and more of fine treatment and more in detail. But we don't need to crack anything.
Oh, right. Okay. I know that's the one thing. I always when they crack your back.
So that extremely gentle techniques. That basically like this is if it is okay to touch.
Please, yes.
All right. So what I do is something like this, and I just feel the tissue underneath the skin. Called fascia. And it's basically a soft tissue and continuous all over the body.
Right.
And then this is start treating.
So and you can tell from that. Oh, very interesting.
And when I do the treatment, I ask usually people to do certain exercises. To help align.
Well, I want to talk a little bit more about that. That's very interesting. So we're going to take a quick break. And then when we get back, we'll talk about that a little bit more. Okay? All right. So stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Keiko with Mountain Shadow Family Medicine. Thanks again for being on the program.
You're welcome. Thank you.
Holistic and osteopathic, those are fields that a lot of times people misunderstand. And like we talked about earlier in the program, that holistic literally means the whole person. And in osteopathic medicine, that you look at that whole person. But you still, you do blood work and you do x-rays, things like that, to help identify what the real health issues are.
Of course.
Right. But at the same time, you've been trained and know that our whole body affects our health. The different, like we were talking about earlier, your posture, how you walk and stand, all of those things impact your health.
Right.
So, and of course we talk about we are what we eat, and so your diet's obviously important.
That's
but
right.
then sometimes we're missing things, especially here in America. I think our diets are so poor. So do you work with people on their overall eating habits and maybe special supplements if they need that? Or
yes.
So
usually I check when I check blood test, and depending upon each individual, if necessary, I order some blood tests of vitamins.
Oh,
vitamin
see what they're
levels.
lacking.
Right. And a lot of people, even though we have a lot of sunshine here in Arizona, lack of vitamin D.
Because maybe they don't get out enough, especially as you get older, probably.
And then that can give that can affect the energy level.
Yep.
And also the bone health.
Oh.
Okay. And overall, vitamin D is quite important, especially for elderly or middle-aged women.
Yeah, right.
Okay. So
well, I know myself, I was born and raised in Minnesota, and I used to have, every winter, I'd go through this major, you know, I forget what they call it, but just almost a depression from not getting enough sun. As an adult, when I was working and I'd leave, it was dark, and I'd come home, it was dark, and never see the sun. And when I, you know, so that's why living in Arizona, I just love being here with the sunshine and getting outside and enjoying that. So going for a walk even outside helps get your natural vitamin D, right? But as we get older, that gets harder, obviously, for some of the seniors.
Unfortunately, some people do not cannot absorb, maybe, or cannot make, the body itself cannot make enough.
Okay.
And in such a case, you know, just supplement is helpful.
Okay.
Right.
Is there vitamin D in foods we eat, or is it mostly through
just vitamin D fortified food?
Oh,
there
true.
are some.
Right. Okay.
But when each patient comes and talk to me, and then I try to find out that what kind of food they're eating. Well, basically health, lifestyle.
Right.
And so that then depending upon that, and then I individualize the recommendation
for them.
Okay.
Right. Well, I thought it was interesting before in the earlier, just your touch of my hand, I could really feel that. And, you know, that's, so you're able to do that, you touch different parts of their body depending on where they're hurting or the sickness is?
Usually, when I do the osteopathic manipulation, there's a specific time period, which is longer than the usual encounter, and so that I can work on the whole body. And in this also, that I have a hard time separating just a specific area from the rest of the area of the body.
Because you are all connected.
So I have to go through, for example, usually I start from the leg portion, and then at the end, I go to the cranial.
Okay.
So, well, some area initially I may find that the rhythm of the soft tissue under the skin may not be appropriate. And then when I come up, there is certain area of blockade.
Oh,
okay. And then when the blockade is clear, and then the rhythm go back to normal.
So it's like the circulation.
It's not the circulation only.
Right, but that's part.
It's really hard to say what exactly is, but there is a basic life rhythm.
Okay.
Okay. And of course there are, rather, or energy, or we are made of fluid, majority of it.
Right.
So the fluid has to run, not necessarily in the vascular system or lymphatic system, but it's kind of wet, right?
Okay,
everything. Otherwise, we are mummy. So.
I've seen a few people that spend too much time in the sun that look like that. No. Too much sun. No, but no, I see what you're saying, though. We have that fluid in all of our tissue.
Yeah, that's right.
Okay.
And also, the brain produces cerebrospinal fluid.
Oh, okay.
And so when I treat the cranium, that basically head, and then I get into the cranial, the bone, and then brain tissue, and then cerebrospinal fluid flow.
Okay.
So all those things that, well, for me, typically in one treatment, I go through everything.
Okay. So at least to that initial,
just
when you first see the patient.
It's not necessarily first see the patient, of course, depending upon the necessity and appropriateness of the treatment. But that's the treatment in the cranium is vital for life and energy.
Without the brain working, nothing else much works, right?
Well, of course, heart is very important too,
right?
And everywhere
but it all
else
kind of is
too.
Connected.
But in a sense, from my background, doctor of osteopathy, and that is vital.
Makes sense. It does when you think about it. And I know I find it interesting too. Like I had issues with my thumbs, and I thought I was getting arthritis in it, but then it turned out it was my neck. And that old song when I was a kid, I don't know if you know, the neck bone's connected to the knee bone, and it is how we are all connected, the whole body. And you can have something down here that affects in your hands, or like you said, in your head, it can affect something else. And I think a lot of times people just don't realize how much our bodies are actually pretty amazing. They're a miracle, just that they do what they
because
do.
just imagine the skeleton is so thin, and then we are carrying the big body.
The weight
well, of course, I'm small.
Well, yes, you're tiny, but there's others of us,
And also the head is heavy.
Because that's the biggest bone, right? The skull.
And also on top of the tiny neck vertebra. So
yeah, that's
if
true.
you
I hadn't
imagine
thought of it that way before.
So
but
it's amazing to balance the head on top of this tiny
skinny thing.
Foot or feet.
Right. That's true. I hadn't even thought of it that way, but it is pretty. You'd think that we just topple over when you look at it like that.
Right.
So it's again, so that whole process of how.
Yes, that's why that going back to the the previous part that we talked, and the posture is very important to minimize the stress to the back or knee or hip or all over underneath head.
I think I need to come see you. Well, so we talked about how you got into osteopathic. You mentioned briefly your Japanese background.
Yes.
And I know that's maybe more prevalent in Japan, that whole body, than we've in the past in the U.S. has been. We're getting better, I think.
Okay. We have MDs and no DOs.
No DOs?
Well, actually, there are DOs, yet DOs are not recognized as a physician in Japan.
Oh, okay.
And so I think that, well, of course, United States is a little different.
Right.
Because a DO or doctor of osteopathy started in this country.
Oh, that's interesting. I didn't know that. You'd have thought it would have been like in Japan or somewhere
When
else.
I was in Japan, I didn't know DOs.
Oh, very okay.
So, but the medicine in Japan is allopathic medicine.
Okay.
However, the way we live,
yes,
is more of holistic type of living
than it is here in the U.S.
So that's why it is inside me, because I was born and grew up in Japan.
Okay. So when did you move to the U.S.?
I think 14 to 15 years ago.
You've been here a while. Okay, very good. Well, time flies when we get busy talking. I always enjoy this time that we have together. I always tell people I learn every time I'm on this show. I learn something new. Do you have an office number that someone could call if they'd like to make an appointment? Do you know what your office number is? I should have looked that up. I just realized I don't.
928-681-8530.
8530. So 681-8530. Someone could call to make an appointment if they'd like to see you. Okay. Thank you for being on the show today. I hope you all learned something new today about holistic medicine like I did. Stay tuned for us next week. We'll have another great guest on the show.